as I was saying, we're really excited to have you today, Jessica. You have a really unique overlap of experience in being a clinical respiratory therapist and then also getting into cannabinoid therapy and education, later in your clinical career.
Yeah.
So today's theme is really taking a deep dive into, first of all, just understanding the basics of our respiratory system, how that is involved when we do an inhalation method of consuming cannabinoids, and then just a lot of practical information that I feel like, I didn't know before talking to you, that a lot of people have never learned, had no access to this knowledge. So it's really precious to have your time today. Thank you for being here.
Well, thank you for having me.
And I'll add to, we kind of made things more exciting this month by adding a drawing component to
Yeah.
this live event. So on the theme of inhalation, we chose a prize of a Puffco Peak Pro vaporizer, which I've heard is really good for controlling temperature.
Temperature is key. Yeah.
Which is something you're going to talk about soon. But so the only thing you have to do to get your handle or name entered into the drawing is ask a question during this live session. And our awesome teammate Matthew is actually helping us to kind of field the questions, make sure I see them. And even if we don't have time to address your question, you will still be entered into the drawing to win the Puffco Peak, and we'll announce the winner at the tail end of the session. So we'll get to see who wins as well. So with that, let's dive in.
Okay.
I think my first question for you, Jessica, is just, can you tell us a little bit about your background as a clinician, as a respiratory care practitioner, and then later I'll ask you kind of how you got into cannabinoids.
Yeah, so a lot of people didn't even know what a respiratory therapist was for, I guess, until COVID. But so as a respiratory therapist, a big part of our job is making sure you're breathing. So it comes down to whether we're working with asthmatics or lungers, or my focus was in the ER, in the ICU, and critical care. So open heart patients that are on ventilators or needing assisting breathing with different equipment that we would run. Then I focused more into neonatal. So I was in the neonatal ICU working with micro preemies, 23, 26 weekers, and going to those deliveries and helping. And then towards the end, 21 years, towards the end, I kind of just focused on working on transport. So we would go pick up other babies from hospitals and bring them to our hospital if they needed more critical care. So with that, when you're a team with the NICU nurse, you're doing thoracentesis, so you're tapping the chest for pneumothoraxes, you're still intubating, you're putting IVs in, you're running the equipment. But the sad part of our job is, you get to help people and you revive people and bring them back and they get to live their full lives. But the other part is when you go in and it's a patient that's been on a ventilator or is not going to make it, and you are the person that comes in to pull that breathing tube and turn off the ventilator. So huge part of a respiratory therapist job is being that person coming in at the end of life. And so after 21 years of coming in and seeing the visual of what you come into, the family around the patient is heavily medicated, usually what we call third spacing, or they're all puffy and they're gorked out. And so there's no interaction. It's not really a quality of life at the end, but my main thing would be to come in and say, has everybody said their goodbyes? Is there anything else, before I pull this tube? Because you would know as their therapist how long they would last once you pulled that out. So kind of, you get burnt out after 21 years of that. There's the happies, the saving and helping people, but that really always is back there. And so after I ended up hurting my back from intubating, because doesn't matter what you do, you have to bend over a certain area, and my discs tore and ended up inflaming, have a lumbosacral spasm, and ended up in the ER myself. So that's when I was put on multiple steroids and medications and things, physical therapy. And when I learned about cannabinoids, that's kind of how I got into cannabinoids, is 4 months of PT and meds and not being able to do my job because of the medications they had me on, which then led to side effects and other complications. Somebody gave me CBD, and that's when I realized, what is this? And why didn't they give this?
I'm assuming it worked really well.
Yeah, it worked instantly. And I was like, 4 months of PT and prednisone and anti-inflammatories and all these things, and nothing was helping, and I was miserable, and I couldn't work on those because
Yeah.
the pain medications altered, and if I'm in a code running a code with a a 27 weeker, I have to be focused and aware, and you can't do that when you're on all those medications. So getting introduced to CBD, and I never had anything against cannabis, I just never used it. I didn't have the need. And so when somebody introduced that to me, I thought, I need to know what this is and how it works and why we're not using it in the hospital. But
yeah, your clinical mind kicked in, right?
Yeah, my clinical mind kicked in. So I started studying everything I could, going to conferences, meeting Raphael Mechelen, talking to him, learning from his conferences, from Ethan Russo, talking to him, like back in the day when we were learning about cannabigerol and CBG, just, learning everything I could, absorbing everything about the endocannabinoid system. And then I could relate that to what I was doing medically in the hospital. Like, well, we could be doing this or adding this. Some of my NICU babies' guts go bad or perf when they're on too many meds, and CBG. So you just start to relate, and then you talk to the healthcare people that you work with, and they agree. But there's such a stigma that if anybody had heard me talking about it in the hospital, I could have lost my license. It's just you're not allowed to talk about it on the hospital grounds. So meeting Mary, who and asked me if I would be willing to join SMJ and start talking to patients. And I thought, this is a way for me to start talking to patients. And even if we just focus on the end of life, I'm giving back that quality of life, because from the scene I started with the, the image in the hospital and the gorked out and the highly medicated.
Taking people off of.
Yeah, taking people off and watching everybody cry as I'm trying to get out of the room with my ventilator. This was a way for me to give back a quality of life to my patients, because not only, take away the stuff we're treating, preventative therapy, things that we could start helping ailments that they don't need certain other medications with side effects. There was a better way to implement cannabinoids and work with specific receptors. Everybody's individual, but find what they need, their profile, and find the right match for them and help them without the other medications they were being prescribed with those side effects. So that end of life became even more, it wasn't so burnt out anymore. It was more of a positive, because not only was that patient,
the quality of life.
Improving not only just the patient, but the family around them is now seeing a different side towards that end. They're happier memories. They're with them. It's not that, gorked out is what we say, heavily medicated, not there. So that's
this is making me. Oh, yeah. Oh, sorry.
Switched to start treating patients with the cannabinoids. And I retired from the hospital after 21 years of respiratory therapy and really went to this. And that's when we were asked to join AIMS with Sunil and Leanna. So yeah, that's kind of how I branched in and really felt I needed to dive in. And because the nerd in me needs to know everything about what it is. And I can't teach you if I don't understand it myself. So.
Exactly. Yeah. So your formal role now is a cannabinoid therapist, right? And you also are an educator. You teach college courses.
Yeah.
You speak at, at all these, a lot of
medical conferences
where you're actually educating doctors and nurses.
Yes.
Because they don't get the chance to learn about cannabinoids in medical school or even after, right?
No, they're starting to slowly, but just going to the medical conferences, the oncology conferences, the family practice palliative care conferences, talking to the other doctors and healthcare workers and relating to them on the medical side. And then I could bring in the cannabis side of it and make them feel more comfortable and understand how they can implement cannabinoids in their patient's patient plan, their therapies, how they can implement it. Or if they don't feel comfortable, have them come to a clinic like ours or talk to a cannabinoid therapist to help that patient work with cannabinoids, but still feel safe and trusting their doctor and having that integrative therapy. So really taking away that stigma, because there's so much stigma around it with the healthcare professionals. It's teaching them that it's okay and it's safe and how they can work together. You don't have to be one or the other. You can integrate
it's not a war, right?
It's not a war.
Approaches.
Combine them and make it a better patient plan therapy. So a better regimen for the patient overall.
I think when, so the AIMS clinic, the AIMS Institute is a huge part of what we do at Polite. And I love the word integrative, right? Because they're an integrative clinic that's taking, the best of traditional medicine, plant-based medicine, and a whole host of other really emergent therapies, right? And it's not an argument about who's right. It's about taking the best evidence-based results,
Of
you know, and
everything. Yeah,
of
and
everything.
we're
Yeah.
all in the room together, you know, with Leanna and Sunil. We were in there, the
Mm-hmm.
patient, myself, we're
Mm-hmm.
all together treating them. So they feel like they're really being heard.
Yeah.
And you're not going from one doctor to the next doctor. They're not communicating. Everybody's
Mm-hmm.
communicating together on the same path, the same patient plan.
Mm-hmm.
So, and you
Yeah.
combine them and work that make them feel like you understand and you're hearing them as well.
Yeah. Oh,
Yeah.
well, we won't have enough time today because there's so many things outside of inhalation that you know about, you know, microdosing, all these
Hmm.
topics. So I guess we'll have to save those for another time. I think there's equally fascinating and things that people really want to understand. But today, you know, since with your background in respiratory care, you know,
Hmm.
teach us about when it comes to inhalation, like what are the basics of how our lungs and our throat and our respiratory system works and how it interacts with cannabinoids.
Okay, so the lungs, they're touchy. They're very particular to what you bring into them. They have a defense mechanism to protect themselves. So when you're born, you automatically breathe through your nose, which is where we're all supposed to technically breathe. We get older, we become adults, we get lazy, we breathe through our mouth. We're
Okay.
multitasking.
Mm-hmm.
So, but when a baby is born, you know, if it comes on the table in front of me, if it's obstructed, any nares are obstructed, or I'm suctioning, whatever, they will not breathe. They will cry because they're in distress. But if you were
Mm-hmm.
to occlude their nose, they will not breathe. They will panic, and then they stop crying. They still will not breathe until their nares are clear. But that's because your nose is your first line of defense. That's where when you're breathing in air, oxygen, and gas,
Mm-hmm.
you filter it, so you're cleaning out any particulate matter, and then you're warming and humidifying it because your lungs are very particular to the temperature of air that comes down, that it's not dry. They don't like dry air, and that it's
Okay.
clean and filtered. So it humidifies the air to come down, and your lungs sit at a temperature, your core temperature is 36.7 degrees Celsius to 38.7 degrees Celsius. That's where your lungs like to live.
Okay.
So this is where temperature is key. And so your next line of defense is something called cilia. Those are little
Okay.
hairs. I've talked about, they're like little janitors in your lungs. They're sweeping, they're constantly sweeping, you know, 1,000 times a second, cleaning out any kind of debris or anything in there because your lungs are moist. Sorry, nobody likes that word. They're moist, and they're covered in mucus because your lungs, they can't stick together. They all have to be open, and so they
Okay.
produce their own mucus, this lining, and that lining kind of takes any particulars in there, and the cilia are constantly flushing them out to keep them clean. So if you just inhale a dry air, your lungs
Mm-hmm.
react. And
Yep.
if it's just a normal temperature dry air, like if you're running outside and it's cold or it's brisk, and you're running, that cold air gets in and you like it just
Mm-hmm.
feels like you can't breathe as well because your lungs actually restrict because they
Okay.
don't like that cold air. They respond immediately. But then we go to smoke or combustibles going into the inhalation of cannabis. So say you're around a campfire, and we've talked about this, all of a sudden the wind moves directions and the campfire is coming into your face and you're coughing and you're hacking and you kind of feel the burn in your throat a little bit. Well, your lungs immediately react, and it's a foreign substance coming into your lungs. So they start producing secretions to fight it. But also the cilia, those little hairs, once
Mm-hmm.
they
The
get up above
janitors.
the little janitors, when they get above a
Mm-hmm.
certain temperature, they get paralyzed and they stop working. So say the next day you start coughing up all this phlegm and stuff. You're like, why am I getting sick? What happened? It's the cilia come back to life and they start cleaning out all the particulate matter from that smoke. You have the polycystic, you know, hydrocarbons. Smoke has, the combustibles have toxins that your lungs do not like, and your lungs are
Mm-hmm.
trying to clean them out. But
Mm-hmm.
every smoke, I used to tell my cigarette smokers for smoking cessation as a therapist, when you smoke a cigarette, each puff paralyzed your cilia for 20 minutes. So they're
Just
gone.
one
So
puff.
just
Just
one
one
puff
puff.
for 20 minutes.
Wow.
So they don't like the smoke, the combustible. It paralyzes them. We say kill them, but it paralyzes them because they come back.
And it doesn't
So
matter if
it's
it's tobacco
no,
or
it's any
cannabis. It's just
combustible.
that temperature, those particulates and toxins. That's what
Yes, it's
paralyzes
the
the cilia.
smoke. It's that dry smoke. They do not like it. It's the
Okay.
temperature. Temperature is key when it comes to your lungs.
Mm-hmm.
So, and they get inflamed and they start becoming irritated. So people who are smoking cannabis and
Mm-hmm.
say they're doing it too hot, you know, your lungs feel fine. Maybe you have a burning in here, or you're used to it. The next morning, you know, it's your cough. So it's still that smoke. Your lungs do
Mm-hmm.
not like that smoke. So even though we know, and there's been studies by Donald Tashkin and UCLA, we know that cannabis smoke itself does not lead to COPD or emphysema, but it can still add to bronchitis, because
Mm-hmm.
bronchitis is the inflammatory response of the lungs and the trachea, the pharynx going down. And that
Okay.
lining does not like that heat, and that's where the
Mm-hmm.
cilia stop. And then you have all this secretion production because your lungs start, these little things called goblet cells, start producing all these secretions in the second line of defense. They're trying to fight the foreign object coming in. So
Mm-hmm.
that's a big key with smoking. Your lungs like humidity, vaporization.
Yep.
That's why when we give breathing treatments, we give it nebulized with saline,
Mm.
because there's a certain osmotic pressure in there uh, that your
That
lungs like.
matches the
Matches
moisture
the
and
pressure in the
humidity.
lungs and the moisture, yeah. And
Okay.
your lungs are also, you have the mucus, but when you get down to the little sacs, you call them grapes, the little
Mm-hmm.
alveoli where the oxygen crosses over, there's a stuff called surfactant, and it keeps it from the surface tension not getting to. Think about a balloon. When you close it and it has a little water and it sticks together. It's really
Okay.
hard to pull apart. You don't want your lungs to do that. So they have
Mm.
surfactant in there to prevent them from
From
sticking together
sticking.
when you,
Okay.
yeah, from when you inhale and exhale, or else they can tear and you can have a pneumothorax, or there's other things that can happen, a pleural rupture. So this is why there's certain substances in your lungs to protect them, keep them lubricated. They
Right.
can't be dry. And that's why when you inhale, I encourage a vaporization.
Mm-hmm.
Whether it's a vape pen or you get a flower humidifier, a herbal vaporizer with the flower, because you want that humidity in your lungs, or your lungs will fight you. And that's where you
Mm-hmm.
get the bronchitis or the irritation. Again, we've seen enough studies to know that doesn't lead to cancer or emphysema or COPD, but there's still bronchitis and enough irritation, inflammation
Mm-hmm.
from that smoke itself.
Mm-hmm.
So
So
temperature
that's
is key, and dry.
okay. So that's kind of like one basic lesson, right? That if
Mm-hmm.
you compare smoking, which is also a form of combustion, right? That
Yes.
higher temperature,
Mm-hmm.
if you compare that to vaporizing is going to be less harmful for your respiratory
Yes.
system because of
More
the
preferable.
humidity, because of
Mm-hmm.
the lower temperature,
Yes.
and then also the particulates. Is that right too?
Yes, you don't
Okay.
want those particular matters from the smoke. I mean, it doesn't matter even if it's a clean product. Even if you have clean flour, you're still heating up with butane or cigarette. It's
Mm-hmm.
you're still heating up. You're still causing those hydrocarbons from the smoke, and those are still toxins in your lungs. And your lungs don't like that dry smoke.
Mm-hmm.
That's where they start to fight, because they,
Right.
like I said, they're well lubricated. Think of it, it's oiled in there. They don't like
Mm-hmm.
to be dried, and they start to stick, and they immediately get inflamed and irritated,
Yep.
and so then they
Mm-hmm.
swell and it gets harder to breathe, and then it produces more secretions, and those secretions can get kind of clogged in there if your cilia
Okay.
aren't coming back and cleaning them out. So somebody
Mm-hmm.
who's smoking continuously, like somebody who smokes cigarettes,
Okay.
once they quit,
Mm-hmm.
we've told them, the first 3 months they feel like crap. They're so sick. They're coughing all this stuff up, this black stuff, which is the tar and the arsenic from the cigarettes. And then it goes to brown and red. There's a rainbow of colors we get to see a resuction out of your lungs. But um, your lungs, because those cilia are coming back. So they're starting to clean all the stuff and the debris from the
Yep.
years of smoking out of your lungs. But it takes 3 months to even get that clear. So people are really, they get so mad at me because they're like, well, I'm the sickest I've ever been. If I smoke a cigarette, I feel fine. Well, yeah, because you just paralyzed the cilia again. So they're not doing their job.
Yeah.
So it's really a process after to
It's a
help your lungs clear
detax.
out. It's a
Yeah.
detox, yes. And your
Before,
cilia
yeah.
are really trying to cleanse your lungs out. But
Mm-hmm.
so that's the
Mm-hmm.
thing with nicotine. But it's the same with cannabis. Those cilia will paralyze at a certain one. That's where the cough comes, and the
Mm-hmm.
secretion production, the
Yeah.
sputum comes up, and
When
then you
it's
get different
too hot.
colors.
Yeah.
Yeah, too hot, and then you can get, if you're not ever taking a break and your secretions aren't allowed to clear, then you can get pneumonia or pneumonitis or other
Mm-hmm.
kind of inflammatory
Mm-hmm.
responses from that. So that's where vaporization really is key, to keep that humidity to where your lungs like it, but it's still temperature. Too high of a
Mm-hmm.
vaporization becomes a combustible.
Yeah.
And also, we like our cannabinoids, we like our terpenes. So if we go too high, we're burning those off. We've lost our boiling points and we're no longer getting the benefit of the whole plant.
Mm-hmm.
So lower temps are best. You
Yep.
still need to activate your cannabinoids, decarboxylate,
Mm-hmm.
but you want to preserve those terpenes, which are just as important as the cannabinoids themselves. And
Mm-hmm.
those, start in the 250, 260 boiling points. So lower is better. And when I say these, I mean Fahrenheit. Those are because
Mm-hmm.
most of the equipment comes in Fahrenheit. So
Yep.
I prefer vaporization but it still has to be a clean product. You have to
Yes.
know what's in it. If you're using a vape pen or oils, that there's no additives, there's no thinning agents, because those are the carcinogens, not the
Hmm.
cannabis itself. It's the additives put in. So it's knowing the product you're using, clean product, whole plant, not adding terpenes in because your lungs don't like extra oils.
Hmm.
It's kind of like olive oil and water together. They
Yeah.
don't mix. So you
Hmm.
need the whole plant itself. It's not having a synthetic added
Yep.
in. So
Synthetic flavors or
yes,
yeah.
those are the ones that cause you can end up in the hospital. Those are what cause the inflammatory response and pneumonitis.
Hmm.
The
So not even the thinning agents. It could just be
no,
the flavorings that are
yeah, the flavoring
synthetic.
agents themselves. Yeah,
Yeah.
most of them have gotten rid of the thinning agents, but
Hmm.
they're still out there. So you really need to read your labels, and then the device itself. You know, convection
Hmm.
is best because you're getting the whole round process versus the burning of it. You know, spot on. So you like that
Hmm.
convection; it gets the whole plant kind of around, heating up, and so you're getting that full vaporization as well.
Hmm. So,
If that makes
um,
sense.
it does like the way it's heated matters too, right?
Yeah, the
So,
way it's heated, the
yeah.
equipment where you got it, you know, is it got lead in it? The whole product itself matters. The equipment you're using, the product, the flour, the oil you're using, and then how you're using it. All of
Yeah.
those play together.
Technique. Yeah. We'll
Technique
talk
is
about
key.
yeah,
Yeah.
we'll talk about that one in a little bit. But before we get into that, why would someone want to vape inhale cannabinoids in the first place? Like, why would someone choose that format versus,
Other modalities.
smoking or, tinctures or capsules or edibles? Like,
Yeah.
what are,
So it's really about the individual. You have to find, I mean, when a patient comes in, it's not, cookie cutter. It's not one size fits all. You talk to them about what is their ailment, what is going on with them. And then you have to remember everybody responds differently. Everybody has their own cannabinoid sensitivity. So you work with them. You always start low. That's where microdosing is key. You don't want to go too high and overshoot. You find out what ailment is going on with them. Say it's chronic pain. So you have chronic pain, and then depending on where you're going, you want to find the right cannabinoid profile to target those specific receptors and G proteins. So you start there. And then it's, well, if the pain is so bad in the morning, so then what do we need to do to find the right regimen for that patient?
mhm,
So if the pain is severe in the morning, they may need that instant where inhalation is immediate. You know, it hits
mhm,
the blood-brain barrier within 5 to 10 minutes. However, it doesn't last as long. So say in
right.
the morning, I have you inhale. That's your initial dose to kind of get through the pain. Then I'm going to have you take a tincture, sublingual in the mucus membranes, and that'll absorb in about 20 minutes, but it'll last about 6 hours. So then they're going to go to work. Well, they're at work for, say it's a 12-hour shift, they're a healthcare
Mhm,
worker, or somebody's at the hospital, and you can't smoke there. The tincture is harder to carry with you. So I'll have
yeah.
them take capsules, and I'll say during your lunch break, it'll be, about 4 or 5 hours after your tincture, we know that's going to start to wear off. Let's take a capsule with your lunch, get those fatty acids in
Mhm,
there to really help boost it.
mhm.
But then, take an hour for that capsule to kick in, but it'll also last longer,
Yes.
8 hours till you
Yeah.
get home. And then you
Hmm.
go with your night regimen. Maybe then you need just another tincture. And if it's a sleeping issue, maybe some CBN, a vape to CBN to go to sleep, but that tincture will last you throughout the night. So
Hmm.
it's really finding the right modality and cannabinoid regimen for that patient, that individual, what we're targeting, and how their life is. You want them to have that quality of life. You don't want them to change their normal routines. They have kids dropping off, soccer, whatever we're doing.
Yeah. Yeah.
You're working. We don't want to disrupt that.
Staying
We want them to
functional.
have, yeah, we want them to
Yeah.
have their normal daily routines. So
Yeah.
that is where it's key in working with that individual, finding
Hmm.
out what kind of cannabinoids and terpenes, because terpenes are just as beneficial, helping boost. Again, I'm always about microdosing, and then finding the right modality regimen for them to get them through the
Hmm.
day in the best way possible to have the best potential outcomes. And
Hmm.
that really is key, is focus on each individual.
Yeah,
And
I think that
you can't be negative about whether it's vaping or tinctures. It needs to be what fits them.
that's a really great point. I think, first you have to get through whatever bias or inclination you have towards certain modalities, right? And
Yes.
and then it's figuring out what's actually going to give me the right results, right, and effect.
Yes.
So what you brought up was so interesting because I think a lot of people don't realize the the art and science behind combining different modalities, for health and wellness, right? I think a lot of people tend
Yeah.
to think I'm a this person, I'm a that person, when once you understand the pros and cons, advantages, effect times of each, you can kind of use them strategically, right? To fit into your lifestyle. Yeah.
You can plan them out. It's just like planning, your supplements or, your day. It's planning out what's going to work best for you to make your day most productive, but still keep, whether it's pain or your anxiety or, migraines under control, what you need. And I always remind people, we start low. It's all about the microdosing, because even CBD, I always tell people the first couple of days we're priming your system. So this low dose of CBD may make you feel like you're caffeinated all night. So I say the first couple of days till we know how we really see how you feel, not just physically, but emotionally. That's a huge component of how we take care of a patient. Just, the happy side effects, as I've said before. We may be treating this, but we're going to find out we're actually healing these other things because they're all cluster symptoms playing together. But I say the first couple of days, don't take it after 6 p.m. till we really know how you respond, because I don't want you up all night from that first priming of CBD. So it's really important to work with the individual, learn how they respond, and not judge them based off all your other patients that have the same diagnosis that you're working on.
That's right.
So
everybody's
really individual.
chemistry. So the key takeaway there is that, inhalation, the benefit and why a lot of people choose it is that it's the fastest, is there like a clinical word?
Fastest onset.
That's right. Okay. I mean, the casual way is like, how long does it take to hit you or to feel?
Yeah.
But so the onset for inhalation is the fastest among all modalities. Is that correct?
Yes, it's the fastest, because you're going through, when you inhale anything, gas, air, oxygen, when you inhale it in through your lungs. So, and this is where we come up with technique is key to really get it the full dose. I've, again, being that I was naive to cannabis in the beginning, and then hearing everybody's explanations, well, you have to hold it so long. I'm like, no, that is not working. You're just causing issues. You're going to cause barotrauma. And so when you inhale, it's a nice slow inhale, but if you do it too fast, you're going to cut off your lower lungs. So you need to have this nice, slow, deep inhalation all the way to the bases of your lungs. But when it gets down there, those little sacs, those alveoli, that gas, which oxygen is carrying with the cannabis, crosses the membrane and the blood picks it up. So it's immediate getting to the hemoglobin and carrying through the rest of your body.
And
so
that's the science of the quick onset. Okay.
Yes, and past those membranes. But the other thing is, and we've gone over this before, is they want to hold their breath as long as they can. I'm like, no, don't do that. That's not
biggest misnomer in the world, right?
Don't do that. That's
it's a bad urban legend.
It's very much an urban legend. Yes. So when you inhale and the oxygen or the cannabis go across and get picked up by the hemoglobin to go out to your body, that hemoglobin is offloading CO2. It's like, okay, I'm going to pick you up and you're getting out and you need to be exhaled, because that's the byproduct of when oxygen goes through your body. CO2 is picked up. So as you're inhaling and you're holding that pressure and you're, as deep and as tight as you can, because you really want to get that maximum dose. Well, after 3 to 5 seconds, nothing else is crossing that membrane because the CO2 is pushing against. So now you have all this gas pressure building up in your lungs and you're fighting yourself. And so now you're going hypoxic because now the oxygen's no longer circulating and the CO2 is building up, creating kind of this dizzy feeling. And it's going to stimulate you to cough. So that's where people always tell me, well, the coughing, you got a cough. I'm like, no, that cough is from CO2. The cough is from the CO2 buildup coming out. And they're like, well, then I feel dizzy. It's the high. I'm like, no, that's the CO2 coming out. So when the CO2 builds up, it gives you that dizzy feeling and it stimulates you to cough because you have that intrathoracic pressure building in your lungs. And it can't, the oxygen can't go any further and the CO2 come out. They're kind of stuck in that pattern. So once you inhale 3 to 5 seconds,
that's it.
Hold. That's it. Nothing else is going to cross. You're just going to cause barotrauma, which then some people can get pneumothoraxes and other issues. Pneumomediastinum's up here. Like they won't even know they have a little hold from trying to hold their breath too long. So just a slow exhale and then just wait 10 minutes to see how that felt. And then you go from there. So it's really about finding their best optimal dosing. So I always say it's slow, deep breath, 3 to 5 seconds, exhale. That's it.
Okay.
Really easy.
Okay. And then because coughing is so, I don't know if it's synonymous is the right word with, inhaling or smoking. Like, is it, from your clinical perspective, like, is it's possible to inhale and not cough, right? It shouldn't be like an expected thing. It's actually.
No,
right?
coughing is your lungs fighting back.
Okay.
Coughing, when you cough, you actually close your lungs. So when you cough, your lungs get forced closed really fast. So you're not getting anything
Mm-hmm.
else in there. Nothing else is going across that alveoli, which is where it gets to the blood and you get that high or that feeling or response from any of the cannabinoids. So,
Mm-hmm.
and if you are coughing after holding, that is the CO2 stimulating you to cough to exhale. So that
Okay.
the cough is a forced exhalation,
Mm-hmm.
or if you had too high a temperature, that's the trachea and the bronchi
Mm.
being irritated and inflamed from the heat, and they're stimulating cough because the cilia just paralyzed and they don't like this foreign object that just came into their lungs. So coughing is bad. We don't want
Okay.
coughing. Yeah, coughing is too strong a dose, held your breath
Too
too
hot.
long, or too hot. Yeah.
Okay. We
So
have a question actually.
sure.
Someone was asking, how do you control like milligram dosage when you're inhaling or smoking?
Okay, so you again, I like to go with vaporization, not smoking, because with the
Yep.
smoking, you're lighting it, you're going over the boiling points, you're losing a lot of that milligrams. So there's really no way to know what you're getting if you're smoking it that way.
Okay.
If you're vaping, or like I said, a herbal vaporizer, we're taking the whole plant, or if you are doing a joint, those are not my favorite because you are heating right here and that's too close to have that high of a temperature for your lungs. But if you're using
Okay.
a wick is
Mm-hmm.
better, because that's taking away the heat.
Mm-hmm.
It's reading your label and reading that milligram dosage, and usually I've noticed a lot of vape pens say, how many puffs or doses you have or inhalations you have.
Mm-hmm.
So you're kind of going from there. So if you're doing a 3 to 5 second hold, that should be the single dose that they have on their packaging, the milligram dosage
Mm.
they have on their packaging. So, and then,
Okay.
you wait 10 minutes, and if you have to do it again, then that's double the dose. So
Mm-hmm.
it's reading your labels. Labels are key. And then
Mm-hmm.
there is a math equation. If you really want to get technical, I can email you a math equation to get deep down into
Ooh,
milligram
okay.
dosaging.
That
But
sounds
again, if you're combusting or lighting, you're burning away the milligrams. So
yeah, yeah,
I won't know what dosage you're actually getting. That's
because
the
you
hard
won't.
part with combustibles.
Okay. Yeah, I think that's something that people probably don't realize too. And you had told me about how all these compounds, all these cannabinoids, terpenes, they have different boiling points, right? So,
Yeah.
can you tell me a little bit more about why, THC, for instance,
Yeah. So
is different than the other cannabinoids which have a lower boiling point?
lower boiling point. So your terpenes, and then I love terpenes. Terpenes are very beneficial just as much as the cannabinoids themselves. So the terpenes are the most fragile. They're the first to burn off. They have the lowest boiling point. So if you're going for it's just that high, that THC, and you're burning it, you're missing out on all those flavors and all the benefits, the anti-inflammatory, the anti-anxiety,
Yeah.
the bronchodilator, smooth muscle relaxer like the CBD and alpha pinene have.
Mm-hmm.
You're missing out on those because you're burning them off before you even get
Mm-hmm.
them. And then the flavor can be great, the
Mm-hmm.
smell, but THC is what's left. So yeah, you got that high, but you
Mm-hmm.
didn't get the benefit of the whole
Yeah.
plant itself.
Yeah.
So
You literally burned off
you
part of the
burned off the
plant.
good stuff. Yeah, you burned
Okay.
it. So it's going to the low. If somebody and I think I've said this, herbal vaporizer, because you get the whole plant. You make sure it's an organic plant. There's no pesticides. What's in it?
Pesticides.
You can see the
Yeah.
terpenes. You put it in there. It's convection. You set
Mm-hmm.
that temp. The temp should never be, depending on certain ones. Go 70 to 80. Um,
Okay.
380 Fahrenheit is the highest you should ever go. You should never have to go higher than that. I
Okay.
prefer lower. I
Mm-hmm.
prefer lower than that because you're really preserving those terpenes. I know some people really want to have that effect though from the decarboxylized THC and the cannabinoids, but if you're just doing it for say anxiety or something that
Mm-hmm.
you don't need that THC to help you forget you're in pain, if you're doing it for you don't need to have the effects, that so-called high from the THC, you can go lower and just have the acidic components. Some obviously will be activated. The CBD, we know the acid is not very stable, so it'll decarboxylize and come over. But go lower because your lungs don't like these temps. No matter what temp, they like
Yeah.
36.7 to 38 degrees
Mm-hmm.
Celsius. They
Mm-hmm.
don't like any of these temperatures. So the lowest you can go, the best, and then vaporized.
Mm-hmm.
Because the more you do it, the more irritated your lungs will get. But if you can do it lower and less dosages, less frequency throughout the day, your
Yeah.
lungs will have time to heal each day. And you
Mm-hmm.
won't get that bronchitis and that inflammation that where if you were smoking every day, every
Mm-hmm.
2 hours because you're not getting the full benefits of your cannabinoids because you burnt them off, and you're smoking and smoking and smoking, then your lungs will respond and you can get a pneumonitis or a bronchitis from it. Not
Mm-hmm.
COPD or emphysema, but the other ones
Mm-hmm.
can still kick in.
Is there
So,
a minimum temperature that's required to decarboxylize and activate the compounds and
well, there's
cannabinoids?
certain ones, like 280, 290. I know
Mm-hmm.
like they say the optimal is, I think, like 310 to 390 Fahrenheit is the
Okay.
optimal
Okay. The
temperature
range.
decarboxylase. But we know now that the acidic components are even more potent than the decarboxylase components, CBD.
Huh.
So some of those can be even more powerful if they're not decarboxylates, but if you're making the oil and whatnot. But
Mm-hmm.
it's more about the patient and what they're dealing with. If we're dealing with chronic pain and they're in so much pain, they can't deal with it. So say you're going
Mm-hmm.
into surgery, you're going to have, I don't know, an appendix removed. So everybody in there is all cannabinoids working together. The anesthesiologist is the THC taking away the
Mm-hmm.
pain, so you don't realize that the surgeon and the nurse, the CBD and the CBG, are dealing with the spot of infection, the pain, the inflammatory. They're dealing with the actual site of origin itself, while the
Okay.
anesthesiologist is helping you forget. So that would be the
Mm-hmm.
THC. So they're working together to
Mm-hmm.
take
That's a good
care of
metaphor.
you. Yeah. So
Mm-hmm.
they're all working together, but you need each one of them to get to the
Yes.
point and deal with it and diagnose and treat.
Yeah.
However, if it's so much pain, you need the anesthesiologist to help you forget while you're being treated for the
Mm-hmm.
actual ailment itself. So I
Mm-hmm.
think of the THC as the anesthesiologist. So do you
Yeah.
always need the anesthesiologist? Not necessarily. Sometimes you
Yeah.
can do just fine without the anesthesiologist. So that's where
Mm-hmm.
decarboxylizing or not, or your
Okay.
dosage. But you have to be careful because there's certain cancers and hormonal migraines, endometriosis, ovarian, cervical. Those THC too much can cause problems. That's where
Mm-hmm.
they trigger certain proteins through GPR 18, 1955, and they'll help metastasize. So you need to make sure that your
I
CBD is the
think.
high guy. Yeah, your
Yeah.
CBD should
Yeah.
be the high guy. Your ratio should be better. So you still may not get that
Mm-hmm.
that feeling. So that's where the lower temperatures
Mm-hmm.
be key as well, and knowing that ratio, that you're not burning
Yeah.
off the good guys, because you need those to protect you from activating those proteins with the THC. So
Mm-hmm.
it depends on each patient and what we're specifically dealing with.
Yeah. And I think following instinctually what makes you feel better and worse,
Yeah,
regardless of what other people say, right?
yeah, you individually.
Answer. Yeah.
Yeah.
Is there any type of person or context where you don't recommend them to do inhalation or vaping? Like, are there people that just should not do it and avoid it?
Yeah, there's my emphysema COPD patients. They need to be careful because their lungs are already
Mm-hmm.
damaged, and when they inhale COPD or emphysema, the way it works is those little sacs where the air is, they're overexpanded, so they no longer have that elasticity coming back. So when they inhale, there's always trapped air in there.
Mm-hmm.
So for them inhaling, it's unpredictable dosage. It can actually cause the coughing and that
Mm-hmm.
CO2 buildup, because they already live in a higher CO2 world than we do, because they can't push the CO2 across from their sacs not closing all the way. So they would be somebody I would say inhalation is not best for you, or asthmatics, certain
Mm-hmm.
asthmatics, because an asthmatic a trigger could be a pickle or an aspirin. And so certain
Mm-hmm.
terpenes inhaled can trigger asthmatic responses where it's
Mm-hmm.
a constriction of their lungs. So it's
Mm-hmm.
it's knowing, if that patient knows their asthma really well and they know their triggers, and then you can relate it to certain terpenes, you can know, okay, you really shouldn't have this terpene because it may trigger your asthma attack if you have that trigger with a food or a smell. Because
Mm-hmm.
like I said, a pickle can trigger certain asthmatics to
Mm.
have an asthmatic attack. So, but then, beta or alpha pinene is a smooth muscle relaxer similar to CBD. I mean, it's not a bronchodilator, it won't help you in a rescue, but it can help
Okay.
decrease inflammation in your lungs and
Mm-hmm.
dilate that bronchiole.
Mm-hmm.
So it's really knowing the
Yeah.
person. It's all
Yeah.
about the individual, learning their history,
Okay.
learning what you're working with. But yeah, emphysema patients, not my favorite for inhalation, because the way their lungs are already damaged
Mm-hmm.
from their history, and they're not
Mm-hmm.
working as well as ours do anymore.
Okay.
And,
Uh,
but there's certain patients you really want to inhale too. So breast cancer, HER2 positive, or lung cancer, because you're getting straight to that source
mm-hmm.
of the cancer itself, the lymphatic system, similar
Mm-hmm.
to radiation. You
Mm-hmm.
pinpoint the area and go to it. So this would be a better way to get that cannabinoids to the source
The
of
site.
the site. Yes, the
Yeah.
site itself.
Mm-hmm.
So those ones I would encourage to
Mm-hmm.
use as needed in between their other regimen of tinctures and capsules for long.
Mm-hmm.
You want that longer duration through the day.
Mm-hmm. I was going to ask, so a common question we have is, in our tinctures and in our oral sprays, we combine the cannabinoids together with
Mm-hmm.
herbal extracts. We call, herbal synergists, many of them essential oils from these,
Mm-hmm.
adaptogenic herbs and Ayurvedic herbs. In our vaporizers, we do not add any
Mm-hmm.
essential oils. Can you
Yeah.
talk more about, you know, aside from these obviously synthetic, bad things that shouldn't be there anyways, what
Yeah.
what are the risks or compounds that, you should just avoid inhaling in combination with cannabinoids?
So remember we talked about your lungs have a certain lubrication, a certain oil.
Mm-hmm.
So when you introduce other non-organic terpenes that come from the plant, which those are sticky. If you're adding in synthetics or some kind of oil in there, your lungs are
Mm-hmm.
going to respond and they're going to fight it. They don't like that. This comes back to like that olive oil and water being put together.
Okay.
Your lungs have a certain osmotic pressure. So when you add something in there that kind of out of balance, it's like another liquid being added in there, or
Mm-hmm.
that it's the way they come in. It's because it's vaporized. That liquid still enters there. They will
Okay.
fight it and they will get inflamed, and you get pneumonitis or lipoid pneumonias. So it can actually, it's like a burn. We call it like a lung burn. It can actually burn the lungs inside. So you have to be very careful. When we suction or we do anything in somebody's lungs, we use saline, normal saline, because it has the same osmotic pressure as
Mm.
the surfactant in there that's keeping the surface tension where it needs to be. So those sacs alveoli are not closing. So
Mm-hmm.
surface tension is key in your lungs, and when you're adding these oils,
Yeah.
these synthetics in,
Cannabis.
non-organic,
Yeah.
non-cannabinoid terpenes that are natural to the plant. They're not an added oil put in there,
Okay.
or those flavorings. Those flavorings are just similar. If you think of the flavorings for different vape pens, that foreign object can burn the lungs and cause that pneumonia. So
Mm-hmm.
your lungs do not like
Okay.
extra
Yeah.
fluids put in there that are not natural, because the plant, when you vaporize that, it's not in that oily form,
Mm-hmm.
again mixing that oil and water and causing that burn.
Mm-hmm. Okay, so the
So
takeaway there is when you inhale cannabinoids, stick to pure cannabis extract and
yes,
the cannabis terpenes.
yes,
No flavors, whether they're natural or synthetic, it doesn't matter,
no,
right? Like you're saying,
yeah,
that will disrupt kind of the
disrupt
pressure and the
the osmosis, what's going on in your lungs. Now say, people will say, well, I have essential oils and I have them out in the the room. That's
yeah.
different. You're not
Okay.
directly going over and
Inhaling.
inhaling that directly
Yeah.
down into your lungs. That's out,
Yeah.
and it's the smaller, it's dissipating out there. You're
Yeah.
still getting it, but you're not taking that and inhaling that directly, that oil. You're not taking that oil and trying to,
With
atomize
heat
that
too.
into your lungs with
Yeah.
heat, which then
Yeah.
when you heat up certain oils, they become
Hmm.
toxins. So you really
Right.
have to be careful. Certain things like peppermint added,
Hmm.
that can cause very bad reactions to asthmatics and burns, and they
Okay.
can go into full asthmatic attack if they
Hmm.
were burning and inhaling peppermint oil. So you have to
Yeah.
be super careful with what's going in your lungs. Your lungs, like I said, they're like this little environment of
Hmm.
moisture and humidity and mucus. And
Yeah.
you add something in there, it'll fight
It
you,
doesn't like it.
and
Yeah.
it doesn't like it. And they got pneumonia, pneumonitis, and lipoid pneumonia. So don't do
Somebody
that.
asked, yeah, somebody asked a really interesting question about the pickles. They were saying,
Oh,
is
yeah.
it the terpenes or what is it about pickles
There's a
that,
certain, I don't know if it's the vinegar, it's hard to know, but I've had patients, and more than 10, after 21 years. Some
yeah.
people it's just aspirin. Aspirin triggers their asthma attack. Some
Huh.
people it's the pickles. So I don't think it's the cucumber part of it. I think it's what
Okay.
it's put in with the brine or the vinegar. Sometimes that vinegar
The
that
acidity.
triggers the acidity, and that
Yeah.
smell triggers
Uh-huh.
their asthma, where they've come into the ER full on asthma attacks. So you have to, like I said, the peppermint oil and certain things,
Uh-huh.
those have caused asthma attacks.
The
So
triggers. Yeah.
the triggers. So
Yeah.
it's really
Hmm.
great if you can have a patient that comes in with their full history and they know this is what, boom, 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 boom.
Mm.
The ones that come in and don't know, it's like, okay, well, we're going to start low, and
Yeah.
we're going to just, I know alpha pinene. I know that that's a
Yeah.
smooth muscle relaxer, that'll,
Mm.
bronchodilate, but so that will help with my asthmatics. But again, these are not rescue inhalers. They're
Yeah.
not going to, you're still going to need your albuterol. They're more of like somebody who's taking Advair or Flovent, a long-term bronchodilator. That's more what it is. It's preventing that inflammation and preventing that constriction of your lungs.
Okay.
So,
we have another really interesting question. It says, can you
sure.
inhale THCA and CBDA if you vaporize at a low enough temperature?
I wish. We know that CBDA is not stable. So just sitting on the shelf for a couple of days, it'll change into CBD. So I would love that. But you know, Dr. Mechelen had a big listen to him, went to a conference with him talking about CBDA, how they're trying to find a way to make the CBDA stable so that we can take it in an acid form, because you know, you get CBDA where it's powder or liquid and it sits on a shelf just that couple days, it's not stable enough. That atom changes, molecules change into CBD. So I would love it. Yes, you can inhale THCA if you do it at a low temp. You know, do it in the 250s to 300 degrees Fahrenheit. You usually can still get the THCA component, but the CBDA, not really
stable enough
not stable enough. So I would love it because because we know it's actually stronger than CBD. You know, so
does that mean that if there's a CBDA product out there that it's kind of it's actually just going to be CBD?
It's probably CBD. It's probably CBD. Listening to what he was talking about, because I was so excited about CBD. I'm like, this is fantastic. This is going to be great because it's so much, you know, more potent than just CBD. And then he went over this whole thing about how they're trying to add certain dimers, certain things to it to make it stable. That he unfortunately, I when somebody says they have CBDA, I'm like, maybe, but I doubt it. 'Cause, yeah, he's trying to create that right now in Israel. So,
let's see. We had another question a while ago, kind of to circle back to when you were talking about just overall lung health. Someone had asked, what's a good way to detox your lungs, or you know, maybe you have damage from years of smoking. You know, what are things that people can do to restore their lung health?
Okay. So if it's from nicotine smoke, it's going to take 3 months, 3 months of not smoking, and then no longer to smoke. And while you're doing that, I would advise no smoking of any kind. So vaporizing cannabis at all, because you're still heating up. So you would still paralyze the cilia again. They have to come back fully, and that takes 3 months, because the tar and the arsenic from the nicotine, it actually sits in the bottom of your lungs and it builds up. And it is, I've suctioned hundreds and thousands of lungs, and it's black. It's a black goo that comes out. And as that moves up the lungs, because everything's working to push the secretions up so that you'll cough it up out of your mouth or swallow it. It's up to you. But it turns from a black to a brown to a red brown to a thick brownish yellow to a light yellow to a pale yellow to a white to clear. Once you got clear, you know your lungs, the cilia have completely cleaned out your lungs.
It's really interesting.
You got to go through the rainbow to make sure. And it's about 3 months. That means no smoking the whole time. That means no vaping. If it's just cannabis, if you've been smoking combustibles, you still may take a month, because your lungs are going to take that time to heal. You're not going to have as much gunk. The colors won't be as bad.
The tar,
the arsenic, the toxins, the cystic hydrocarbons are not as bad in there. If it's vaping, if you can just give yourself 2 days to reset your endocannabinoid system, then you're starting out fresh again, and you can start microdosing. So
is that 2 days? Is that the cycle?
2 days is 2 days with cannabinoids. So if you're not a smoker, you're just vaping, and maybe you're taking it over and over, and you're no longer getting the effect. You're like, I'm vaping, nothing's happening. You've oversensitized your endocannabinoid system. They've all been too stimulated. They're stopped working. So if you take 2 days off, you can reset your endocannabinoid system and start back at the lower microdose again. So that's what's key. But yeah, the cigarettes, 3 months, smoking cannabis, a good month. Vaping, if you've had some damage from the vaping, you were vaping too high, you may have to wait a week or two to really and it'll be your secretion production. Just watch the colors of your secretion.
That's the telltale sign.
And your cough. So that'll be the way you have to look at things.
And when it comes to controlling temperature, right? I was looking into it, and it says the average pen, vape pen on the market is 390 to 480 degrees, right?
Yeah.
I mean, that was not good.
That's high. That's not good.
from a clinical standpoint, what the right temperature and the threshold is. So how can people have control over temperature better? Like, are there certain types of products or settings? Should you always be smoking on a low setting? And how do you guide your clients to understand controlling temperature?
Control temperature. Well, I always my main thing is never go above 380 Fahrenheit. There's no need to go above 380 Fahrenheit. If you're doing that, you're just hurting your lungs, and you're going above the, I think 410 or 420 is combustible, where it's no longer even vapor, it's just smoke.
That's a good point too. Yeah.
Yeah. So you're just smoking it at that point. Again, a lot of the new pens, that you've seen have lower temps. Use the lowest setting. Go with that lowest setting. If you can't control the temperature, if you can't turn your temperature down on, like a herbal vaporizer, or a lot of them have, on the phone apps or you can read their label. It says they only go to this high, so that that's safe. With the polite ones and infused, they have the lower temperatures. And just stick with the lower temperature. If you can't set it directly and you can't go 310 to 380, then just go with the lowest possible setting on the vape pen. And then again, make sure when you're inhaling, it's nice and slow. And we know that oils are more concentrated than the flower. So that's where that slow, deep breath, not too deep. It's just a slow hold for 3 seconds and exhale. It doesn't need to be the biggest breath you can take. It's just a slow, deep breath getting down to the bases of your lungs. And then holding for 3 seconds. I always say 3 second max, because there's really no reason after that 5 seconds to figure out your dosing. But take the lowest, and if you feel that cough afterwards, it may have been too deep a breath, or you get too strong a dose for you. So, but it's hard to know with that temperature. You'll feel it in here, and you'll feel it in your chest if it's hot. Some people who like to use bongs, I suggest putting ice in there to cool down that temperature. So there are ways to cool it down, but it's hard to control temperatures, and some things are already preset for you. So read the labels, find the products that already, run at the lower temperatures, get the herbal vaporizer if you have to, but it's knowing the product you're getting.
Yeah. And this is interesting too. Right here I'm holding, it's actually a technical data sheet of the temperature results of our vape pen, right? So you can reach out to a brand or a company, and they should be able to access or provide, data on the average temps, right? I think that's something that I would never think to do, but it makes sense, right? That they should, there should be data. A good quality pen would have gone through this engineering testing, to let you know.
Just like they're testing their cannabinoid profiles. If you want to get the CQ of your cannabinoid profile of certain plants, or what's in your product. Most people will give that to you now. If they really want to sell their product and they're really on it, they will have it available. You can ask for it, you can look it up. Most people will give that to you. And if they're not, then maybe you shouldn't be using that product. That's I'm all about labels and reading and getting the test, so I know what I'm getting. Again, I think I saw solvents on there. I don't want solvents on there. I don't want additives in there. I don't want thinning agents in there. I don't want flavors. I want the natural product. So that's what's key. And again, if it's a vape pen or something that has no temp on there, they won't tell you. It may not even be convection. It may have lead in it. Who knows what else toxins you're taking into your lungs. So the cheaper ones, certain ones they won't give you any. You have to check. You have to research and look into it. And really, if you go to a good shop, the bartenders are pretty good at telling you. Hey, this is the better one if you're really going for this. So it's, ask around, look into it.
Yeah. So I know that you kind of addressed this question. The question was, what is your take on solvent-free? I'm assuming they're asking, should that be the standard? Or is it,
Yes, we don't like solvents. We don't like additives. We don't like thinning agents. We don't like flavors added, because your lungs don't need these extra additives. No, and that's not the organic, that's not the plant, that you're not getting the full spectrum of the cannabinoids and the terpenes if you're having something thrown in there. So I'm not for the solvents.
I think one of the really illuminating things, that I'm learning from you too, is if you don't have the proper technique, you don't get to realize the full potential of the plant and all the compounds, right? So now whether you're burning it off, or you're not activating it properly, or coughing. So I think that's a whole journey, right, for the typical person to understand how they unlock like the true potential of cannabinoids and
the
cannabis, right? Because
the
if
health benefits. Yeah.
yeah, if we just rely on sometimes what's out there or these options that aren't kind of experience or science based or holistic based, you're really only touching the tip of the iceberg,
Yeah.
or it could be counter, right?
Yeah,
Productive.
counterproductive. It's or you're wasting your money, you know.
Hmm.
It's not inexpensive. So wouldn't you rather
Yeah.
use it to the full potential and the best way to get the
Hmm.
most impact out of the product you just spent
Hmm.
all that money on? So
Do
technique is
you?
key when you inhale. That's,
Yeah.
like I with my asthmatics, I used to go over how to use an inhaler because so many used it wrong and then they ended up in ER. Well, my question was, where's your spacer? And if you're pushing it here, it's hitting the back of your throat. You didn't inhale any of that. And with an inhaler, you actually need to inhale it. Where with cannabis, um, you want the vaporization to get the right particle size to inhale it at the right temperature. But if it's something that's being sprayed, because they do have those new devices out there, it looks like a
Hmm.
meter dose inhaler, like an asthma inhaler. But
Hmm.
if the propellant, if you spray it's too fast, it just hit the back of your throat. So you're not going to get that instant um, impact because you didn't inhale it. You'll get the mucosal impact because it hit the back of your
Okay.
throat.
Hmm.
So technique is key, and with the inhaling of the vaporizers, a vape pen or vaporizing cannabinoids, inhaling it and holding it, waiting that 10 minutes, and really knowing what your dosing is so you don't overdose or underdose.
Hmm.
Keeping a journal with yourself, but that technique of not closing off your lungs with too fast of a breath, not that technique where maybe it was too strong because you took too deep of a full vital capacity, of a full deep breath into your lungs. It's just a
Hmm.
slow, simple breath. It doesn't need to be the biggest breath. You're not going under the water. We're not
Yeah.
diving.
You know.
So it's just a slow, yeah, we're not diving. You don't need a maximum vital capacity or full lung volume. We just need like you're just taking a breath to sigh. That's
Yeah.
it. Because then
Okay.
you're getting enough in there. You're getting out to the alveoli, you got three lobes in your right and two in your left. You're getting everything expanded. You hold
Okay.
for 3 seconds. Slow exhale. Don't force it out. The forcing it out is going to make you cough because you're changing the pressure in your lungs and you're collapsing the
Too
lower
quickly.
lobes too quickly. So it's just a
Okay.
exhale and then wait 10 minutes and like, okay, am
Okay.
I feeling any of that? Do I feel whether it's anxiety, pain, seizure, whatever it
Hmm.
is? And then, okay, maybe that just was not quite enough. I'm going to do one more. And then you do it
Hmm.
10 breaths. And then after a couple of days and you keeping track of how you felt, you'll
Yeah.
know the next time you come in, okay, I can just do two, but I don't have
Yeah.
to wait the 10 minutes because I know that's my dose. So I do the
Okay.
one, do the
Yeah.
next, but I'm not holding maximum. I shouldn't be coughing. My throat
Hmm.
shouldn't be hurting.
Hmm.
It's just easy. There should be no stress in it. So
Hmm.
technique is key. And it's just like
Yeah.
teaching as a respiratory therapist, teaching my asthmatics how to correctly use their inhaler because I don't want you wasting the med. I don't
Yeah.
want you, it's a lot of money. I want you to use it properly and I want you to get it easily without the stress of like, I didn't
Hmm.
do it right. And now I took too
Yeah.
much and I'm really not doing well. So it's finding the happy place dosage, optimal dosing wise, but also helping them just realize it's not that tough. It's pretty simple, just
Hmm.
basic breathing.
Yeah.
Yeah.
Oh, I could talk to you forever. It's just I think it's such specific information, but it should. Be so widely known, you know. So
Yeah.
thank you so much for shedding light on the details of inhalation. I think it's just information that we don't have access to normally. Before I let you go, I wanted to announce the winner of the
Oh,
Puffco Peak Pro drawing. So this was done through a digital randomizer, So the
yay.
winner is Ray for Pay. So Ray for Pay will be DMing you to get your address so you can enjoy your prize. But we'll try to kind of include these drawings more during these monthly events. But Jessica, if anybody wants to learn more from you,
Yeah.
you teach college courses on, cannabinoid science. Where could someone kind of, either connect with you or take your classes?
So we, through the Academy of Cannabis and Science, I have a pulmonary dynamics course of vaping versus smoke. It dives a lot deeper into the pulmonary system and the mechanics of the anatomy and physiology. But I believe there's courses on UNLV. I think it's the Seattle Central and maybe Highline. But if you go to the Academy of Cannabis and Science and sign up there, you can sign up to the courses to take those. And they have a lot of other courses too, of other cannabinoid related
Mhm.
um, uh, fields. So Yeah.
What
So
are
and then
what are some of the, I think there's like you have some other topics that you often lecture and teach about too, right? Like you said, microdosing.
yeah, microdosing, and a big part of mine is the female reproductive system. That's again where the THC can be bad.
Hmm.
Knowing that ratio. So teaching about the microdosing and your ratios, cannabinoid ratios are huge when it comes to HER2 positive and cervical endo, cervical cancers, ovarian cancers, or endometrial cancers. Hormonal migraines are treated completely different from other chronic migraines. THC can make
Wow.
those worse. So CBG, cannabidiol, CBD are much better. So through SMJ Consulting at the Ames Institute with Sunil and Leanna, yeah, that's really how to get through to us and ask questions. And then we're still seeing patients, and we're still doing some education videos. So yeah, email through
Yeah.
SMJ Consulting, Ames, or go to the Academy of Cannabis and Science and look up some courses on there.
Well, thank you so much, Jessica. It's been an illuminating conversation. I would like to take your classes too because again, it's I think all of these things, at least the clinical practical application of it, it's so emergent. You know, people haven't been um, consolidating the data or the the patient kind of outcomes on it. So it's really,
Education.
yeah, it's really rare
Yes.
to speak to someone that lives at this overlap. So thank you so
Yeah.
much for your
Thank you for
time.
having me. Yeah, it was great. I'm glad we can get this out there. Don't cough.
Good. And thank you everybody that tuned in for the live. Thank you very much. We'll be back next month with another amazing guest and an important topic. So have a good weekend, everybody. Inhale, don't smoke.
Yeah, don't
for
smoke it.
for the good
Inhale
of
the low
your
temperatures.
respiratory system. No, don't hold it more than 3 seconds, no matter what
Yeah.
some teenager tells you to do.
Yeah. Don't do
And
that.
yeah, don't vaporize any essential oils or additives or solvents.
Mhm.
Keep it pure, keep it clean, right?
Keep it simple. Yes.
All right. Thank you, everybody.
Thank you.